All right, so good morning. So I'm Jeff Middleton, mental health liaison with the Rancho Unified School District. And I'll be here presenting with Sandra, if you want to introduce yourself.
Sure, I'm Sandra Robles, Program Specialist for Student Services. Nice to be here this morning with all of you.
So today we'll be talking specifically about trauma, students who are exposed to traumatic events, specifically how it impacts their, like how they experience school, and that students who have been exposed to trauma may experience school differently. So we'll be looking at a few things, so focusing specifically on understanding their experience, what might have occurred that leads to a trauma reaction. What is a trauma reaction? We're going to focus a lot today on complex trauma. So there's simple traumas and complex traumas. So we'll spend a good amount of time on complex trauma to kind of understand how that might impact our students, or how it impacts young people who are exposed to traumatic events. We'll learn about the impact on the physiology of the brain and sort of how that plays out and changes the neurons and the physiology of the organic structures. We'll recognize the effects of trauma on students, parents, staff, and schools, and look at trauma-informed practices. So it's going to be a combination today of what is trauma, what does it look like, how does it impact people, and what can we do to support our students in the classroom to have to be able to access the curriculum and to progress academically and social emotionally. So Sandra will be speaking at the end more specifically about what we can do in the classroom to impact or to support our students. So firstly, if you could write in the chat box, what are some examples of events that may lead to a trauma reaction? So please share in the chat box, and Sandra will be monitoring that, reading off what you're writing. So what are any type of events, things that might occur to somebody that might lead to a trauma reaction? I think you're muted, Sandra.
Sorry. DCFS removal from the home, abuse, physical and sexual abuse, sexual assault, domestic violence, witnessing a murder, traumatic loss, racism.
Yeah, absolutely. Some great examples. So go ahead.
Community violence.
Yeah. So we're talking about, abuse, talking about, so, and I heard the first one being a removal by DCFS, who talk about, if they're going to be removed, it usually means there's some type of neglect, that happens, some, general or severe neglect, which can be traumatizing, or some type of abuse. And then the experience of being removed in and of itself, can be traumatic. So I heard community violence, so exposure to, witnessing or seeing, especially if it's somebody who you're attached to, you feel connected to, and even especially if it's somebody who's your primary caregiver, who you rely on as a secure base. So that's a really important concept that we'll be coming back to, this idea of secure base, those relationships that we feel attached to or connected to, and when those get disrupted, or if that person is the one that's creating or causing some of the traumatic events involved in it, it has a special impact as opposed to those we don't know or we're seeing. So community violence, maybe we don't see them, but we're exposed to it and it impacts us in a way. But then if it involves somebody that we're part of our family or really close to or rely on for survival in some way, shape, or form, it has an even greater impact. And so we're going to focus a lot on that today around complex trauma, and that means exposure to multiple events of it. So we'll get more into that in a bit. Thank you for sharing. Some of the different types of trauma, we'll go through this quickly, but natural disaster, so losing your home, things changing, that kind of chaos, accidents, wars, terrorism, these can all cause trauma reactions. Community violence, robberies, shootings, school violence, so being involved in that, or being near, or even knowing about it. So a lot of our students are hearing about what's going on in America throughout the last few years, and having a reaction as they go to school. It affects everybody differently. So we'll be talking more about that as we go along. Family trauma. So this is a lot of what we were talking about: abuse, neglect, witnessing domestic violence. In the past, if a child witnessed domestic violence, it wasn't even reportable at some point in the history. Now it is, because we're realizing witnessing domestic violence can have just as much psychological consequences as physical or sexual abuse. So that's why it's now reportable if we witness it. Refugee and immigrant trauma. So the amount moving over, that type of exposure toward just the migration and acculturation process, feeling overwhelmed and scared. Medical trauma, poverty, and racial trauma. So I think that was mentioned earlier as well. So exposure to discrimination, institutional racism, having that traumatic impact, which is becoming more and more. There's a lot more awareness to this type of trauma that's happening in our society, and some really great movements around that. So these are just some examples of types of trauma. COVID-19, has been a distressing event for us as we go through this, and including that as something that can either, whether it creates trauma or exacerbates already preconditions. Some of our students that we're working with have family members who have passed away. Some have very vulnerable family members. Just knowing about what's happening, about how many people have died from this, and just being scared overall, can have a negative impact on sort of the physiology and the worldview. And so when we don't know when or if, so it's like that anticipatory thing. I don't know if it's going to happen. It's not predictable. So we'll get into later the importance of predictability for our sort of well-being, and how we can support those who've had exposure to trauma. But COVID-19 has really thrown predictability out the window for a little while, and has had a big impact on our young people in particular. So just looking at some of the things: separating from families, loved ones not being able to connect, like grandparents, for example. Routines have all changed. There is a higher rate of domestic violence that's occurring right now as people are quarantined or staying at home. So there's a lot more, unfortunately, more calls, to the police around this issue, which means that our young people are being exposed to it, and we're having decreased reports of child abuse overall nationwide. And some of the reasons for that is that they're not coming to school, so they're not in a sort of more private space where they can talk about what's happening to them. They're not sharing with teachers. Mental health is available, but not as widely as available as it once was. So those reports are down. So we're not sure on all the numbers, but it seems to be apparent that our students or young people are being exposed to domestic violence at a higher rate, than before, and that's concerning, absolutely. Like I said, lack of routines, worried about getting sick, worried about other people getting sick, financial worries, loss of work. We were talking about poverty earlier, evictions. I know there's some protections around that, but just the fear of that hanging over. So that instability and unpredictability around basic needs, and the impact that can have. So we're going to focus. So the definition of childhood trauma, as defined by Lenore Tur, is one that we're going to use. The result of one sudden external blow or a series of blows rendering the person temporarily helpless, breaking past ordinary coping and defense operations. So this is a very important piece to just determining whether somebody's having a trauma reaction. Just because somebody's exposed to something does not mean that they're going to have a trauma reaction, or have the symptoms of complex trauma, PTSD. We've all been exposed to different types. The things that we've written about, we've all been exposed to them. Some of us have coping structures, or it doesn't surpass our threshold to handle them, to cope with them. But when we're exposed to something that's beyond that ability, that's when these kind of different symptoms that we're going to talk about more come up for especially young people who, as the younger you are, the less coping strategies you have to deal with life's challenges, the less sort of cognitive ability you have to understand the world and what's going on in it to make sense of it. So you have to kind of rely on more primitive defenses or coping strategies that sometimes can aren't enough to sort of manage or cope the challenges that they're dealing with. So it's important to remember that not all adverse reactions lead to a traumatic event. That children are also resilient as well. So that is an important factor in as we're determining who needs support. So once again, just because they're exposed doesn't mean that they absolutely need it, but we're going to assess and follow up. So prevalence of childhood trauma. So 2 out of 3 children and youth were exposed to violence in the last year. So once again, just because they're exposed doesn't mean they absolutely have trauma reaction, but that's a very high rate. So of these, 50% report more than one form of victimization. So like I said, we're going to get into complex trauma. These things can happen multiple times. And then, the ACEs study did some really amazing work, sort of longitudinal studies looking at the fact that 1 in 5 adults report 3 or more adverse experiences as children. And the ACEs study is really looking at the impact of exposure, not just on our psychological well-being, but on our physical well-being. And that those types of, adverse experiences can lead to higher rates of diabetes and other sort of physical issues, heart issues, as a result of exposure to those environmental factors. So that's been a really amazing study. So this kind of takes us through a little more details about it. 8% have experienced, so looking at young people, 8% have experienced sexual assault, 16% cyberbullying, 17% physical assault, 39% witness violence. And those in low socioeconomic areas are at a higher rate, are exposed at a higher rate than higher socioeconomic areas. So youth of color also, so ages 12 to 19, also exposed to higher rates of traumatic events. So African American youth living in urban low-income communities, American Indian, Alaskan, children with disabilities, refugees, LGBTQ youth. So all are higher risk of exposure to childhood trauma. So these are important factors. So, we're going to look at, PTSD, so post-traumatic stress disorder, that is the diagnosis that's in the DSM-5. So we're going to talk a little bit about PTSD, but we're going to mainly focus on acute trauma or type 1 and or type 2 complex trauma. So acute trauma, type 1 is exposure to one single event, so like a car accident or a robbery that happened. So it's a one-time thing. Particularly, from somebody that you don't know. And the prognosis is usually, the recovery time, it's usually pretty good. You're able to recover, from those types of events over a period of time. Some require professional help to move through those events, especially if you've been exposed to previous traumas growing up. Then a single incident can have a longer lasting impact and kind of bring up all the old experiences. So we're going to focus today on type 2 or complex trauma, so the experience of multiple and or chronic and prolonged developmentally adverse traumatic events, most often of an interpersonal nature. So that's what I was speaking to earlier. So child abuse, neglect, domestic violence, these are all things with people who are supposed to keep us safe, and the experience is not that. So that has a different kind of impact. PTSD and the diagnosis was really created around those that were returning from war, adults returning from war. So it was looking at, sort of later exposure to traumatic events. So as, somebody who's 18 and above, and what their